And good evening, everyone. It's that time again. It's time for Natchez Renewal Radio right here, 97.7 The Beat, NatchezRadio.com, right here in this studio. We've got the 44th Mayor of Natchez, Mayor Dan Gibson.
Hello there, Mr. Leon, and it's good to be with you this evening.
You too, young man. How
Merry
you doing?
Christmas.
How you doing?
It's looking like Christmas around here.
I'm
Feeling like
telling you.
Christmas. I'm doing great.
Most importantly, be sure to tell Santa I was good.
That's right.
That's the key.
Oh, Leon, you've been really good. I know you have. You've been really good. And also I want to remind people to shop local because 'tis the season. We need to support our local merchants and also support our local charities. We've got so many out there who need our help during this time of season. I have a special guest this evening. I have the CEO of Merit Health Natchez, and his name is Kevin Samrow. And Kevin was at our board meeting today, gave us an update on healthcare in Natchez and how well things are going out at Merit. We're so grateful. I was talking about shopping local. Also, it's important to, I think it's good to get your health local, too. I'm so grateful to have my own doctor, and Marla's right here in Natchez. We've got some great doctors, some great things happening out at Merit. And so, Kevin, welcome.
Thank you very much.
Here.
Merry Christmas. Nice to meet you, Mr. Leon.
Mm-hmm.
I do shop local. I got this suit here local, right there on Main Street. So,
man.
yeah.
I've actually got I bought my wife an anniversary gift there last week.
Is that right?
And I've got an order in on something right now.
Oh.
Yeah, we've got a great men's clothing store right there on Main Street.
We absolutely do.
Mile marker 363. We were there last week for our Shop Local campaign.
That's right.
Well, let's talk about Natchez and how Merit is meeting the need. I know it's been quite a year for y'all, and you shared some really good news with us today.
Yes, we did. We've had a wonderful year, not only of taking care of our patients. We have wonderful healthcare providers that do a wonderful job of taking the patient's needs into their thoughts and in their prayers and being able to guide them as they take good care of them. We've been really successful with some recruitment efforts, not only for our local staff, our staff level, but also we've got some exciting news. We will have pain management groups starting here early next year. We have another orthopedic surgeon that will be starting early next year. I just signed a letter of intent with a doctor who will be coming in 2027. He's an internal medicine and a pediatrician, which is both needed in our community. And I'm excited to share we actually have another doctor coming to visit here right before Christmas and potentially being another full-time doctor that will start early next year. So we have a wonderful avenues to be able to hire and train and keep the talent that we have here locally. So,
Kevin, one thing you shared today is how you are actively recruiting for every specialty we really can imagine we need. And you have shared with me privately some of the recruiting incentives, the bonuses, helping pay off debt for medical school, moving expenses. Y'all are really stepping up. You're really getting serious, and we're glad to hear it.
We have a very comprehensive package for our not only our doctors but our nurses and our clinical staff as well. So yeah,
yes.
We're doing a very good job of being able to not only help put them through school with some tuition reimbursement while they're actively working for us, but also if you come to us with some student loan debt, we can actually pay back some of that student loan debt that you may have. So, and that's for nurses, that's for doctors as well. So yeah, we recognize to recruit and retain within our within this market, we need to do what we can to say you're welcome to please join us and please stay with us because we're doing great things right here at Merit Health Natchez.
Well, let me talk about this. Just a few months ago, my doctor referred me to Merit for a routine test. It went great. Clean bill of health. I was so grateful. But while I was there, I heard this baby music playing.
That's right.
Tell us about that. What does it mean when you hear the baby music playing?
That means that a baby was just born into our world, and so we like to celebrate that with a little music. I like to hear it when it's twice in a row. That means we've had twins, or 3 times in a row we have triplets. In the last 12 months, we have delivered 513 babies into this world. So
when can I get them registered to vote?
That's out of my
Oh, man.
wheelhouse.
That's wonderful. It is. That's such a special thing, and it really hits home for me because I just became a grandfather, just returned from getting to meet my little grandbaby, Noah.
Congratulations.
He's just little, and he is so cute. And my son, who's now on his own, married, 31. It's just amazing to see this. We got that picture 3 generations. And now I understand why all grandparents carry their phone so they can show all these pictures. But over 500 this past year. I think you had about that many last year.
I think in 2024 we delivered 507 babies, and in the last 12 months, of which would be December of last year to November of this year, we delivered 513 babies.
That's wonderful. Yeah. That's wonderful.
513 new lives into our world.
You also have some great specialties, and I know people won't always complain about what we don't have. I want to talk about what we do have. You've got a great cardiology program going, and you were sharing today about licensing, accreditation, and how we're moving forward in that area.
Yeah, sure. We have 2 wonderful cardiologists that take care of our patients here locally. We have a tremendous general surgery, OBGYN programs. As a matter of fact, we have a robotics program here where we're about to do our 3,000th robotic surgery right here in Natchez. We anticipate that reaching that milestone in January of this year. We're lucky to have 2 general surgeons and 1 OBGYN surgeon who are very, very up to date on all the newest technology as it relates to that robot, and they're very supportive of doing those procedures right here in Natchez. And
That's
so,
great.
and mentioning the regulatory stuff or the accreditations, we recently went through a full Joint Commission survey and our lab survey, which is done also through Joint Commission, 2 3-day surveys that CMS backs to come through us to make sure we're providing the best care, providing the standards of care. They look at our policies, our procedures, they follow patients, they look at our medical records, they talk to our team members to make sure we are doing the very best in healthcare. So,
well, your ratings are showing that. You shared today that you have seen how many thousand patients encounters?
We have over 104,000 patient encounters in a 12-month period. We are actually on track to get that in 2025 as well. We do almost 19,000 ER visits. We do almost 2,400 surgeries a year. We do almost 2,400 admissions a year. If you look at all of our ER visits, our clinic visits, all those patient encounters, that's 104,000 patient encounters. That's a lot of lives we get to touch.
And in touching all these lives, you shared, there's a rating system and people rate you. You've had a 23% increase in ratings. So tell us a little more about
if you look at our Google ratings, in which everybody's familiar with Google ratings, if you look at our Google ratings, and if you look at the overall hospital, and I don't remember the exact numbers, I think we had a 32% increase in actual people who are clicking the button. And we actually saw our numbers go from a 4.6 to a 4.7 out of 5. And just so you know, as far as Google ratings for hospitals go, the average is 3.1 for hospitals.
Wow.
We had a 23% increase in Google ratings, which means 23% more people click that box, click that button, and we moved our ER Google rating from a 3.7 to a 3.8, I believe, and the average in the nation is a 3.0. So we're well above the average in both of those categories under Google ratings, and we're doing that by at the same time as we're getting more reviews. So getting more patients come through the system, getting more reviews through the Google rating, and we're proud to share that.
My mother-in-law had a fall, and we had to go to the ER the weekend I was running for mayor. This was back in 2020 during COVID. And I will never forget, she's doing fine. I will never forget, my wife Marla was out of town in Texas, and it was on me to see everything through, which I did, and it really bonded my mother-in-law and me in many ways. I'll never forget just how kind everyone was to us, and over the years, as I've gone there for various situations, loved ones, and even some of our employees in the city, when we've had situations, I've always been really touched by the kindness that you show and the cleanliness. Now, for a time, I know ICU was not fully staffed. I know you. That was a short time. The rumor got out that y'all didn't have enough people keeping the ICU open. That's far from the case. ICU is functioning.
Yeah, that is absolutely true. ICU is functioning. We're taking care of patients in there today. Regarding the staff and how kind they are, I've met more 20, 30, and 40-year employees right here in this one organization than I have met in the aggregate of all the hospitals I've worked at before this. They are tremendous. They're kind. They're loyal to this community. They're loyal to each other. They're great communicators. They're great bedside givers. We are very, very lucky to have those healthcare workers in our community. But as you mentioned, there are times, and across the country, there's not enough doctors or nurses and our healthcare providers, and so we are competing against those other markets to get them to come here and stay here. And
right.
and with that, we do have to we do see at times where we run a little short in some areas, and so we do the best we can with getting them to the right level of care. But right now we are open, and we are taking care of patients today in our ICU and our step down. And throughout the hospital.
And I've really got to talk more about the people you have there, and I know people are saying, well, the mayor is really bragging on Merritt, but what will we do without our hospital? There are a lot of places around the state and around the country that would just do anything to have the hospital that we have here. And by the way, it looks beautiful, decorated for Christmas. I always love seeing the Christmas tree and lights up there on the roof. But I'll never forget, during COVID, I was going out there every week to have a COVID update on how we were dealing with the pandemic. And we had a bunch of heroes. Everybody showed up, and they were so loyal, so faithful. We had some challenges. We actually had some deaths among the staffing at the hospital, and yet no one stopped. They just kept persevering. I remember we had a special moment where we gave certificates of appreciation to so many of our heroes. Well, they are still heroes every day. Just a few months ago, and I know we can talk about this because you have told me y'all actually have a video on it, but I had an individual who called me, very affluent gentleman who had some hunting camp property outside of Fayette. In fact, he was up in the Red Lick community in a tree hunting, and he got bit by a rattlesnake. And thanks to the law enforcement between there and here, he made it to Merritt, and then Merritt very quickly brought out the antivenom, and this man survived. In fact, he says Merritt saved his life. Tell us more about that. And some of these great success stories that people don't get to hear that often.
Well, and that's the sad truth, is that we have wonderful stories. We have hundreds of heroic events happening every day at that hospital by those healthcare workers. We're very, very lucky. Every day they're silent, they're getting it done, but we can't go out and talk about it because we are, by law and by the privacy for the patient, which is right, is we're not allowed to share those good stories because we might tell somebody something that the patient didn't want them to know, and they are protected. So we don't get the opportunity to go out there and share the good news that often. But in this case, this gentleman, he actually came back and he did a video. And so I've asked our marketing director to post that on our website and on our Facebook page so that you guys can go hear it from him on our Facebook page.
We'll share it.
Yeah, we'll share it. Well, he's what you said is true though. He got bit while hunting. And he got to the hospital, and we were able to do the wonderful things that we needed to do to be able to protect him and his future. And so we have other stories where people were in heart block, and they come to the hospital. We protect them. We get them treated so that they can sustain that life, and then we get them to the next level of care. And we'll actually share that video of that gentleman. He actually did a video for us, too. He said the same thing. Without Merritt Health Natchez, he wouldn't be here, and that's sadly the truth. And so very glad to be able to be in a situation where we get to help people for a living, and I'm just super excited that I get to share this. And so thank you very much for allowing me to be here.
Kevin, another thing too is these videos would be good for you to share with us so we could get them out there, because we do get, as you would anywhere, I mean, we get some complaints. What I like about you is I can give you the name of that person.
Absolutely.
You'll call them and you'll work through it. It's actually a good thing for you to hear from the public if they don't have the experience that they feel like they should have, rather than just say, the hospital isn't doing this. It's far more constructive for them to reach out to you.
We have many avenues where we can talk to our patients. As a matter of fact, our healthcare leaders, including our nursing leaders, round on every patient every day to go through there to see how their stay is. And we're learning things, what we're doing right, and we're learning some of the things that we could be doing better. But I will tell you, far more of our patients are telling us we're doing a great job, and they're giving us, writing names down on who they want to recommend for certain awards and stuff like that. So yeah, and there's many avenues to be able to share the good news with us, share the wonderful things that we're doing at Merit Health Natchez, and if there is something that you have a concern with, please. There are avenues you can reach out to us, and I'll be glad to talk to anybody. So,
well, I will say this, Kevin, you have been extremely responsive to me ever since you arrived here. You and your wife have gotten involved at church. We are in church together at Jefferson Street. You've also gotten involved in so many civic groups, from Rotary to Crew of Phoenix. I missed your dance routine last year. I heard you were really good. You were one of our dukes in the Crew of Phoenix during Mardi Gras.
That's
what
true.
was that like?
So that was an experience that I didn't know what to expect, but it was something I recommend everybody do. The bonds we built, getting ready for that, the fear, the stress of all, the anxiety, the excitement of getting that done, caused us to kind of build a better relationship, form a great bond, and I believe I will have friends for the rest of my life through that experience.
Great. It is. I know you and your wife have invested in real estate here. Your girls in school here, but now I think are you an empty nester?
We are empty nesters now.
Man.
My youngest graduated
weird.
from Cathedral. She's now at ULM, and my wife, she with her older sister. So both my kids are right there in Monroe, and and we spent the first couple weeks being sad and being a little sulky, and then we realized, heck, we still like each other. We're still fun people, so we're having a ball. So I'm not mad at my children for moving out.
Kevin, you've been in healthcare a long time. In fact, at one time you were right up the road in Vicksburg. Is that right?
I joined the Army right out of high school, and I was an X-ray tech and a nuclear medicine tech in the Army. So my whole adult life has been in healthcare.
Thank you for your service.
Well, thank you. It was a pleasure and an honor. So
now you were in Vicksburg at Merritt there. How long ago?
So I got to Vicksburg. I was the chief operating officer from, I think, May of 2017 till September 2019, somewhere around there. And then I went to Oklahoma, and I was the CEO of CHS Hospitals in Oklahoma for just shy of 4 years. And when my wife found out Natchez Hospital was open, she said, "Kevin, you're putting your name in the hat for that job." And we arm wrestled, and she won. And so I called my boss and said, "Hey, tell me about Natchez." And he said, "Man, we'd love for you to go." And so I came here, interviewed, and it's been one miracle after another happening. So we are lucky to be here.
We're so glad you're here. Well, you have been investing in upgrades at the hospital. You were sharing some of that today. Tell us more about that.
So we invested $1.88 million this year. We put new roofs on the hospital. We have a new CT that's going in right now. We've got new ultrasound.
A new
64-slice CT machine, which is going to give us better imaging, better diagnostics, quicker. We've done an upgrade to a radiology room, which is with the newest upgraded digital radiology stuff. We have upgraded our digital portable X-ray. We've got new endoscopy equipment in our OR. The list goes on. We are continuing to improve and prepare ourselves to give great quality health care for the generations to come.
That's good. That's great. And I love the fact that you partner with others here in the Miss Lou area. We are so grateful. You know, you've also increased what you're doing and invested more for cancer treatment. You were sharing. And
well, we give a lot of, we donate. We're very active in the community, And so not only were we active in the community, but with our volunteer work, but on different boards, but also with donations. And so, and we donate to several of the nonprofits, and some of those are cancer related. One in particular actually is one that will actually they donate to, and then they turn around and get free mammograms to the community. So,
yeah. But I just love the fact people don't realize that Natchez is becoming a hub for care in so many ways. And we're so grateful also to have our partner, Mary Bird Perkins, right down the street from you, actually just across the street. And what they've done there, investing over $1 million in their facility the last several years. But it was a great moment when we were on the bluff together this year. And and you were really sporting your pink. I tell you, we were there every year. We have Paint Natchez Pink Day, and Merit Health Natchez is our major sponsor. We also raise a lot of money for the American Cancer Society here, and we just really appreciate what Merit has done in that area.
Well, and we're glad to do it. The reality is we got to get the information out there, educate our community, so they know what to look out for, so we can catch that cancer early. So.
Yeah, you know, early detection is what's so important, and I don't care. You know, women definitely getting your mammograms, but men making sure you stay on top of colon, prostate. Is so important to get the early screenings, because that can definitely increase your chances of not just surviving the cancer, but really just getting right through it.
That's absolutely
and we
correct.
have so many survivors in our community, and I'm inspired by them every time we have an event. Another great thing that I love about Merit being such a good community partner, until the state cut it, because the federal government cut it, we had Project Surge. And Alderman Frazier brought it up today because he had a grandson involved in that, who now I think works at the hospital, if I'm not mistaken. You have several of the Project Search graduates working there.
We do. We have 2 of the Project Search graduates working on our facility, and most of all of them have gotten jobs throughout the system. So, or not our system, throughout the community. And so that's a wonderful project. One that they did a great job throughout the state. Unfortunately, there was some funding issues, and they weren't able to continue that. But as soon as they're ready, we'll be ready to open it back
I
up.
hope we can see it continue. Talk a little about your partnership with Alcorn and their nursing program.
Well, Alcorn is putting out wonderful nurses, and we need those nurses.
Yeah.
And so it makes sense that we are in constant communication with them, making sure that we are providing the space for their nurses to come do their clinicals, and we do a little bit of recruitment when they're doing their clinicals. As a matter of fact, we've implemented an intern program, and the majority of our interns come from Alcorn students. And
wow, one of the top nursing schools in the state.
They do a wonderful job.
Really great. We're so proud of them. Kevin, let's talk about the employer that you are. When we talk about shopping local, investing in the local economy, it's so important to understand we're supporting a hospital that is our largest employer.
Absolutely.
How many people do y'all have on average?
So on average, we employ roughly 400 employees, and some of those are part-time, some are PRN, some are full-time. But as a whole, we pay out last year in 2024, we paid out $29.8 million in payroll. And those employees, they take that money, they pay taxes on it, they spend it locally. It's a great economic boost, and it's wonderful that we are here so that those employees can have a job and feed their families and invest and go to school. And so on top of that, we provide a lot of benefits to them, not only educational but also for healthcare and all that other stuff. So it's a wonderful organization, wonderful people. And I'm just happy I get to be a part of it.
That's great. Well, what I'm looking forward to doing is sharing more of this good news over the next few months, because we, going into 2026, are getting refocused on our Med Natchez strategy, medical economic development for Natchez. And we're so grateful to see the growth already taking place in the MISLU. Got a new podiatrist last week here in our community.
I met him.
And everything
very nice
just works
guy.
together. Yeah. And so I also want to take this opportunity as we look forward to 26. We are in a time where we've been challenged budget-wise. We've been seeing cuts. Everyone's worried right now about the future of affordable insurance and a lot of things changing in Washington. What do you see 26 holding for us as far as access to health care here in Natchez?
So I don't foresee any changes happening in 2026. If you look at all the stuff that's happening in Washington, this is my opinion, by the way. This is not, this is my personal opinion, is that none of those changes are supposed to really start taking effect until 2028. And I do believe before 2028 that the government will get the path so where that nobody loses access to care.
We really need to make sure that happens, especially in communities like Natchez, where we have so many who are in need, and we want to always make sure that they have access to health care, because that
Absolutely.
access is a life or death situation.
It
really
absolutely is.
It is. It also is life or death to a community, because it's hard to attract new businesses, new industry, new citizens, and to retain the citizens we have if we don't have top care health coverage and health, programs. Well, we want to thank you for everything you do. We're glad you're here. How long have you been here now as our CEO?
I've been here just shy of 2.5 years.
That's
It's been a
great.
wonderful 2.5 years. So
Yeah. Well,
we plan on retiring right here in Natchez.
well,
so.
we're really grateful for that. We are. And please tell Rebecca hello. And,
I sure will.
And we wish you a Merry Christmas. Also, we want to wish a Merry Christmas to all of our heroes who work not only at Merit, but all of our healthcare providers here in the Miss Lou.
Absolutely.
Because you truly are heroes. You're saving lives every day. And sometimes I believe you're the unsung heroes, because it's not easy doing what you do and dealing with these life or death situations in so many of these cases. So thank you. Thank you for what you do.
Very grateful.
Well, we are getting into Christmas season big time. I'm going to say a couple things before we sign off, Kevin.
All right.
I hope you'll continue doing your shopping local.
I will.
And we're going to be back out there tomorrow doing some shop local videos, so watch for that. Mr. Leon, have people been shopping local at Arts Natchez?
Absolutely, Mira.
Great.
You know that.
I know.
Yeah.
A lot to choose from there.
Yeah.
And so many other great specialty stores, not only downtown, but throughout the Miss Lou.
Right.
I told them today you can buy everything from a new car to a men's suit right here in Natchez.
Right.
And people often say, well, there's just nothing I can find here. I actually, as a challenge last year, I did 100% of my Christmas shopping right here in Natchez. And Marla said it was the best Christmas we ever had.
Very nice.
And so I highly recommend it. We will be back on next week, and then we'll be counting down the days to Christmas, right? So not a whole lot left in this calendar year.
Right. Also, I'd like to invite you guys down to the gallery this coming Saturday evening for Second Saturday. We will be highlighting one of our local artists.
Okay.
Robin
From 5
Person.
to 7 p.m. Yeah, Robin
Yeah.
Person is her name.
Okay.
Yeah.
Well,
Great.
thank you very much.
That's this
Absolutely.
Saturday.
This
Thank you
Saturday.
so much. Thank you, Mr. Leon. Also, any of our seniors listening, we will have our senior party for the Senior Center happening this Friday at 1 o'clock. Always a great thing. So many other things. If we start announcing what's coming up, I just tell people, go to Visit Natchez events, and you'll find everything from the Natchez Little Theater to the Polar Express to the European Christmas Village to the trolley. It goes on and on. Also, a big shout out. We just gave a key to the city to Coach David King. We're proud of the Rebels. Again, state champions football, Adams County Christian School. And then tomorrow we will have a special day on the front steps tomorrow evening celebrating Forrest Johnson, local guy, investments guy here who has run a marathon in all 50 states. He's now one of the very few people in the world to have run a marathon in 7 days on all 7 continents. We're going to be excited to celebrate him tomorrow. A lot of great things in Natchez. I just want to say God bless, and Kevin, thank you again.
Thank you very much. I
Kevin,
appreciate the opportunity.
If anyone needs more information on Merit, if they want to talk to you, if they want to get in touch with someone on your staff, maybe they had a situation they need to talk to you about, how would they contact you?
Well, you can go to merithealthnatchez.com and hit in one of those links to email one of us. There's a lot of different paths. You can call the hospital, and you can ask for administration, ask for me directly, and we'll just go from there. We'll put you in the right spot to get you to talk to who you need to talk to.
All right, great. Thank you so much.
Thank you.
That's been Natchez Renewal Radio right here to 97.7.